Hello, everybody. I am the Proactive Caregiver, and I specialize in educating others on how to be proactive by empowering you, the caregiver. Because if you cannot take care of yourself, then you cannot take care of your loved one. Today, we're going to continue from part 1 of the Medicare series and go into part 2. We want to get into the details a little bit further because now we are actually in the U.S. Medicare Annual Enrollment period through December 7th. And what you need to be aware of is what are the parts, the premiums, and all the other stuff that goes along with the increases for 2024. Last episode, we actually covered a little bit about the differences and the confusion when people discuss open enrollment or annual enrollment. And I know it can be very confusing because we have Medicare versus the actual employee open enrollment time period. But when you're trying to help your loved one and actually get into the details of Medicare, we need to understand the specifics a little bit more. So again, with me today is Monique and Joe Barajas from Barajas Insurance Group, and they're going to help me get into the details. We also talked last time about the Medicare Supplement versus Medicare Advantage. But what gets confusing is when it comes to talking about the individual parts. I understand that for various reasons, inflation or otherwise, there are going to be some increases. What can we expect? What can the caregivers expect when it comes to Part B?
So if people don't know right now, depending on your income, your modified adjusted gross income, probably seen around as Maggie. If you make $97,000 as a single person, or $194,000 as a married couple filing jointly, your standard Part B premium for 2023 is $164.90, and that's projected to go up in 2024 about $15 to about $179.80. We're still waiting for that final word that should be coming any moment. But that's what the projection is for Part B premium. As long as you fall within that income bracket. And the estimation for 2024 for the income bracket does go up. So it's not 97 for the single person or 194 for the married filing jointly. It does go up roughly about $6,000. But again, that's all about to come out and be released by Medicare.
Nice.
Any moment now. But what I would like to take a moment on, if it's okay, is talk about what I get a lot of questions on. When I define what I just said, what the Part B premium is, people call me and say, well, how come I'm paying more than that?
Oh, yes.
When I get that call, it's because there is a little thing that Social Security sends, a little notice that says, hi, we have done an income-related monthly adjusted amount known as IRMA adjustment, right? And because you've made so much money, you don't get to pay the in 2023 the $164.90 or whatever the Part B premium is in the normal threshold that I just said. You don't get to pay that. You pay more premium, and it does not just affect the Part B.
Right.
It also affects the Part D. So you get hit on both ends with that higher premium.
Wow.
Yeah, a lot of people when they call me and want to talk about why they see, this $164.90 advertised everywhere, why aren't I paying it? It's because of this IRMA. That's what it's known as. But what I try to tell people is while this exists, this is not a forever deal. It's always based on your 2-year income. Oh, here's a classic example. I'm 66, Joe, and I'm getting my Medicare. I'm about to retire. I'm going to apply for my Part B since I'm retiring. And I'm being told that I'm paying way more than the Part B premium that's advertised everywhere. And I've made more than that threshold that you just mentioned. But I did that when I was 64, 2 years ago. I didn't do that this year.
Right.
I didn't earn that this year.
Right.
Okay, well, the thing is they look 2 years back. It's always a 2-year look back. And so what people should know is if they're in an IRMA situation, they should look they should go to Social Security and say, okay, well, if I'm in it this year, when I was 65, I didn't earn that. And so you can actually go to Social Security and say, let's look at this IRMA again. Obviously not that year because they're looking at 2 years behind.
Right.
But you can go in when you're 67 and say, now look at my 65-year-old income, so that you can adjust again, hopefully down to what the Part B premium is at whatever that year is, right? Because who knows what we're talking about at that time, right? Could be different time frame. Could be 2025, 2026, and then the Part B premium would be different. But you can then have it come down on the Part B and premium side. Yeah, and
that's
Part
a relief.
Yeah. But I just wanted to, I know that you had asked about Part B, and I know I kind of went off onto that IRMA, but it's kind of important for people to know that there is some kind of adjustment that's made by Social Security for that Part B premium and the Part D. And there's about 5 brackets before it just, if you're in that 5th bracket, it just kind of goes on. But there's 5 brackets where it's determined what your IRMA is going to be.
Yeah, the adjusted income. So it's going to be higher than what they call the average of the Part B.
I see.
Yeah. And then, of course, it also swings the other way, right? So Joe talked about if you make more, right? So then your premium goes up and up and up for, the 2-year look back, like he was mentioning. But if your income is lower, for those folks who are making a limited income or a lower income bracket that may qualify for Medicaid or low income subsidy, then that is when the state can pay for that premium.
Yes.
So, it kind of goes both ways again.
Right. The pendulum swings.
Mm-hmm.
But it's good to know that there is an adjustment that can be made and you're not locked into it, because that's the other part of this. As people are retiring and they are adjusting to their benefit changes, they're on fixed income. And it's the idea of being stuck to that going forward or having to pay a higher rate consistently, it can actually be.
Yeah, and yes, and also the thing that happens is if you're looking for whatever specific policy, right? Somebody lands on a Medicare supplement with a prescription drug plan, 2 different policies, but they purchase it to go with their Medicare. And then all of a sudden, they know what they paid, they saw the price, but then they're getting a letter from Social Security saying, oh, by the way, your premiums are higher. The thought process is, oh, that's because I signed up for that insurance plan. And it has nothing to do with that. It's completely independent. Same thing on the Medicare Advantage side. It's advertised all over the place as low premiums, right? But that's not what I'm paying. So what's going on? And so the thought process, again, if this is not properly educated to the client, the IRMA is, that's because I signed up for that particular plan.
So they see it as I have the wrong plan and they're ready to change to a different plan just because they don't understand the difference.
Or the associate or agent that helped me misled me.
Right. And that's not the case.
Right.
It's all income based. So when we're looking at this, that you covered the Part B and we started to mention a little bit about the Part D. Can you explain a little bit about that?
So, yes, Part D is for your prescription drugs. So as soon as you get on Medicare, once you're Medicare eligible, what a lot of folks don't maybe miss like the fine line, but if you don't get on a prescription drug plan when you're first eligible, you have a 63-day window. You may be eligible for a 1% penalty fee of the national drug average.
Wow.
Yes, of that year. And so that number it depends on the year, but that it always increases. But as soon as you get on a prescription drug plan, this affects anybody on Medicare. There's different stages. So there's 4 stages in the drug with the Medicare prescription drug plan. First is your initial deductible. So depending on your plan, some plans don't have deductibles, some plans do. Again, this can include Medicare Advantage with prescription drug plan or just a standalone. That's increasing from 2023 to 2024. So this in 2023, it's $505 is the deductible. Next year, it's going to go up to $545
for the prescription
prescription initial deductible. Gotcha. So that's stage 1. Again, if you don't have a deductible, that you just start at the next stage, which is the initial coverage stage, right? So as soon as you get to the initial coverage stage, you pay your copay. And what a lot of folks don't realize in their pharmacy, whatever pharmacy they go to, should give them monthly statements along with their insurance plan of like where they are in the stages. But they pay their copay. But that copay, they also add the retail value of it. So if you're taking a prescription drug that's maybe an insulin or something that is a specialty drug with a higher value, but you're only paying a lower copay, they take both of those values and they add them together to get to the next stage. So they not only are taking your copay, but what the actual drug cost.
Wow.
Yeah. So a lot of people that are taking those expensive drugs, those name brand drugs, they will hit what we call the coverage gap, which is also known as the donut hole.
Right.
If you've heard that term. Once you get the deductible, you have to reach $4,660. So it's $4,660 in 2023. It's going up to $5,030 in 2024. So once you reach that $5,030, again, that's your copay plus the prescription drug, the actual value, because everyone's like, oh my gosh.
What the plan pays,
Yeah, what the plan pays. Then you go into what they call the donut hole, and that's where you're responsible for 25% of that drug. So yeah, we've been getting phone calls from clients and reminding them this is why your prescription has gone up significantly, because you're in the donut hole. And most of the time they will catch it on their monthly statements, but sometimes we just put the mail in the trash and we don't open it. So it's a good reminder to reach out to your agent and just get that clarification again. And the agent can also work with the pharmacist to kind of make sure we're on track, or with the plan, they normally know when you're going to be getting out of that donut hole. So once you get out of that, they go into catastrophic coverage. And this year it's $7,400, and next year it's going up to $8,000. So once you reach that out-of-pocket threshold, starting in 2024, there's no copay.
Yeah, so that's brand new for 2024.
That's brand new, so that's good news.
In 2023, it's a 5% co-insurance or a small copay if you hit the catastrophic coverage. But as Monique is saying, new in 2024 is once you hit the 8,000 number, that's a true max out of pocket where there won't be a copay.
And again, it's that 25% plus the value.
Yeah, the 5% will be gone. It'll be eliminated.
I'm glad you said that the statements were come out, because I can imagine that the caregivers are already overwhelmed with the information, and that statement is set aside.
So make sure you open the mail from that particular plan that you're on the drug plan or the Medicare Advantage plan with the prescription drug. And you'll see how much you're paying, the copay plus the, what the plan pays. And then you can kind of see on your monthly statements if you're going to hit it. At. Yeah, some people never hit it, and then some people that do take expensive prescriptions will probably know exactly what we're talking about.
And they will probably hit their max sooner in the year than later. So then the low income, so we have the low income subsidy, and then we have the IRMA, and this back and forth pendulum between the two. It seems like it creates a lot of pockets for people to fall through. And then hitting this change and hitting this difference when you're going through the insurance and you've got Part B covered, you've got Part D covered. And we discussed in the last episode that people referring to Part C is really the combined of the Medicare Advantage.
Correct.
Is there also a Part A that is mentioned?
Yes. So Part A does cover hospitals, like just if we're talking basic Medicare. And there is no premium to that if you've worked in the United States for at least 10 years or 40 quarters. So that's usually just a given. So there's no premium. However, if you haven't worked in the US, or you're not, married to somebody that has, because sometimes the spouse maybe didn't work, but they could pull from their, spouse's Social Security. And in that case, they wouldn't have a premium either. But if they didn't, then there is a premium to Part A for some folks. But that is,
Yeah, Part A is designed to be premium free if you worked for 10 years, and have to be consecutive 10 years of paid into the Social Security system for 40 quarters. So it is designed to be premium free. but it's not if you haven't worked enough.
Yeah.
This is, it's always amazes me with the information, the amount of information, and that the caregiver has to understand their level of income. And in many cases, if it's the spousal caregivers and how that affects their level of income, as they're adapting to this change of insurance, they're looking at it as the individuals because in many cases, a caregiver one of the spouses, let's just say the caregiver may reach their age limit to be eligible for Medicare before their spouse.
Right.
So the difference between them, is there something where they have to actually consider their insurance or be able to keep their spouse on their insurance, or do they have to actually get separate?
That's a great question. And again, it's a case-by-case situation depending on the individual. So if their spouse, we always say, let's look and see if the spouse is working and you're on an employer plan, let's go ahead and see what those benefits look like for that year. And we can see, is it worth, staying on that employer plan? Because if the spouse is allowed to stay on, that's considered credible coverage in Medicare's eyes. So that is okay. And so or maybe the plan benefits aren't as great, or they're not allowing the spouse to be on it, then they're kind of forced into the Medicare system. And so then in that case, they would still look at that individual's income, but they would, if they're married and they're filing together, they count it as a couple. And those those incomes range for getting that extra help. So they change every year. We only have the 2023 numbers right now, which we can share. But again, those are all different levels. So there's low income subsidy. There's what we call QDWI, which is Qualified Disabled Working Individual. QI1, which is Qualifying Individual. SLMB, which is Specified Low Income Medicare Beneficiary, if we don't have enough acronyms. Yes. And then lastly is QMB, which is Qualified Medicare Beneficiary. And so again, those all are just income levels based on either individuals or couples. In that case, like I was mentioning earlier, the state can help pay for that premium depending on their income.
Wow.
I know. It's a mouthful.
It is. And it's just understanding. And this is where the caregiver or the customer or client would most likely say, I don't know what to do. Please tell me what to do. And
yes, and that's where we say, call a licensed agent who you can sit down with. We actually have sat down at many kitchen tables with caregivers and, their family members and said, okay, let's see, let's look through the mail. What do you have? We're always researching and trying to see what the options are and how to navigate them to the plan that best fits their needs.
Right. And that's where it's hard to point out because someone may be focused in that moment right then and there, but things change. And as things change, well, let's create a plan. Let's do this year, and maybe next year let's revisit and look at it, and always look through the statements and not be quick to set them aside like they're not important, which I understand. There's so many details going on. And Medicare in itself, there are so many details. So I appreciate you being able to help the caregivers and their families find an economical plan that helps them. Because there's already enough struggle as it is financially. And so adding the other area of necessity through insurance.
And it's gotten so much better in the Medicare space as far as Advantage plan options go and prescription drug plans. They are very competitive with the benefits, and there's many options.
Well, and also to kind of piggyback off of what you just said, Jess, about the, there's so many different scenarios, so many different income levels, so many different things that could happen when a husband and wife are trying to decide, hey, do I need to stay on a spouse's employer plan or do I need to individually go to Medicare and get my own policy? And, one thing I'll just kind of, since I talked about Part B earlier, one thing I'll kind of add on to that is that, you can bypass paying for your Part B if you are still working, right? Because it's all about income.
Right.
We're talking about people on fixed and limited income potentially. And so the decision that a lot of people who are approaching 65 are making is, I'm still going to work. And I'm going to work till I'm 70, 72,
Right.
60, 68 is a common one. But the point is 68, 69, 70, doesn't matter either way. You want to continue working.
Right.
And another question I get, and I may have touched on this in the past, but another question that I get is, if I don't take the Part B, you just talked about Irma paying higher premiums. Monique is talking about the late enrollment Part D penalty for not getting it after 63 days. Is there a Part B penalty? Well, there is if you deliberately don't take it and pay it, right? But if you are working and you're on an employer plan, well, you have credible insurance, as she mentioned, credible coverage.
Right.
So you don't have to pay for a policy that you're not going to use. That's what Part B would be. You're paying for that policy, or that Part A and Part B. You can stay on your employer plan, work as long as you need, but then the moment you decide to retire, and get off the actual employer plan, then you need to get the Part B to avoid any penalty. But there has been confusion in the past with prospects and clients that have contacted us saying, am I going to be penalized? I've been working for 10 years. I'm 75 and I want to now look to get my Part B. What's going to happen, right?
Right.
Now, as long as you've worked and maintained that employer plan, no penalty.
And that circles back to the first episode when we were talking about special elections. That allows that special election, losing employer group coverage.
Right.
You have 63 days once you decide to leave that employer plan. So just plan ahead. Obviously, when you're retiring, you have that date in mind that you want, that's your last day.
Right.
And just know that you have, 63 days after your last day of coverage from your employer to avoid that penalty.
It's ironic to me that I don't think I've ever met a single person that hasn't said, I can't wait to retire. Like, everybody knows the age they can retire. But there are a select few that want to work. They enjoy working.
Absolutely.
Or that's what gives them purpose, and they go beyond that retirement age. So
when I get somebody that says that they're about to turn 65 and they want to continue working, I'm like, well, 65 is a new 35. Do what you feel is right. Take care of your family, and whenever you need a resource like myself, Monique, or any of the Barajas Insurance Group agents, we're here. Whenever.
Right.
And not to say, even if you do work part-time or full-time, you can always look at the options and see, hey, how much are you paying in your employer plan? Are you paying,
is it more expensive to stay on there?
Or is it more, economical to get on Medicare and get on a lower to no premium Medicare Advantage plan?
Which is true, because some people actually continue working and stay past their retirement age because of the idea of thinking, if I stop working, I don't have insurance, because they don't know the difference and they haven't looked into the difference of what it would actually cost if they change plans.
Right.
And healthcare costs, just everything in general is going up, unfortunately, with inflation. So you're right.
Yes, and when you're talking about caring for a loved one that may need a special care, then every single dollar counts. And if there's a policy that you can look into and that you would be able to help explain the details and weigh the pros and cons of what you're going for, then I think every caregiver needs to do this on an annual basis, because life happens and changes from one year to the next. And even if inflation is causing the cost to rise, you may not need something you previously had, or you may need to get something you haven't had.
Benefits.
Yeah, just to cover and protect yourself from increasing costs. So then, in the areas that you're able to help, what areas does big insurance cover?
So we are in Texas, and we service all of Texas. We are also in Louisiana. We're in Georgia, Florida. We're also in New Mexico, Nevada, and West Virginia. Nice. In January, we're going to be in California and Colorado.
More families to help. That's awesome. And for the listeners that are interested in asking about any particular insurance plan or insurance companies, how do they get in touch with Big Insurance?
Yes, so there's a couple of ways. The easiest would be to call our 800 number, and that goes directly to Joe and myself, 1-888-347-2278.
Awesome.
And then we also have our website, biginsurancegroup.com. You can also find us on social media, on Facebook, on Instagram, and on LinkedIn.
Excellent. Well, thank you.
Yeah.
Thank you
you.
for sharing
Thanks
this
for having
information. This is definitely, like I said before, not a piece of information or type of information you're going to want to gloss over. And unfortunately, I have also been in the situation where I thought this isn't important or it wasn't needed because of that period of time or the age that I was at. But now understanding, regardless of my age or if I'm eligible for Medicare or not yet, my loved ones need this information. So as a caregiver, I found it important and beneficial for me to know more information to help them. Because like I said, if you don't take care of yourself, you can't take care of your loved one. But part of taking care of yourself is reducing stress, and reducing stress comes from being educated and getting the knowledge you need when you need it. Alrighty, ladies and gentlemen, I hope this episode gave you a lot more food for thought. You can find more information about this on the blog at proactivecaregiver.com, and this episode will be on YouTube as well. If you have any other questions about Medicare, please drop me a line and we'll see if we can get that information out to you through social media. But until then, thanks for tuning in and be proactive. Take care, everybody. Thank you for joining today. To find out more about becoming a proactive caregiver yourself, visit proactivecaregiver.com and subscribe so you never miss an episode. Music provided by www.joystock.org. The Proactive Caregiver is produced by Canon Light Media.